On air, online, on point.
Slave times when
Confidence of the American people.
The state of
Why
the
the habit.
district attorney wanted to get rid of it.
Watching more hours.
Hello and welcome to On Point. I'm Michael Mayer. Today we're going to be discussing the redefinition of autism. The American Psychiatric Association is considering merging the 4 types of autistic-related disorders into one single set in the next diagnostic manual. On Point's Ashley Soley-Cerro talked to CSUN psychology professor Deborah Berry-Malmberg about the proposed change.
Well, the current definition in the DSM-4 has 3 different areas, so socialization deficits, communication deficits, and then restrictive and repetitive behaviors. And now it's moving to kind of combining those first 2 categories, so the socialization and communication deficits are going together into one category.
Now let's go to Ashley with more on the story.
Thank you, Michael. Joining us today is Emily Iland, the president of the Autism Society of Los Angeles, an adjunct professor teaching an autism class here at CSUN, and is the mother of a 28-year-old son with autism. And Bonnie Ramos is in her 36th year of teaching, has taught kindergarten through adult education, has a master's in reading disorders and administrative and curriculum development, and is the mother of a 23-year-old daughter with autism. Thank you for joining me. Ms. Iland, is there anything you can add to help our audience understand the 2 definitions and the difference between them?
Yes. Well, there are 12 diagnostic criteria currently for autism, and they fall in 3 categories: social, behavior, and communication. That would be for autism. There are 4 criteria in each of the 3 categories, which means there's 12 possible criteria. And to have a diagnosis of autism, you have to meet any 6 of those. That's basically how the diagnosis works. Currently, the criteria for Asperger's syndrome overlap those for autism in 8 of the 12 areas, and the distinction being in the category of communication. People with Asperger's are considered to not have a language delay, so that would be how we currently look at autism and Asperger's syndrome. And then what they want to do in the next version is keep the common features of socialization and behaviors that are in common currently and get rid of the communication category, so that they're going to lump together the features that are in common and call that autism spectrum disorder, and not make a determination regarding the communication, because that was causing confusion. People saying, well, if the person can talk, that means their language is normal, therefore they don't have autism. And so a lot of people were being excluded based on their language. So this is an attempt to get around that problem, because it wasn't very functional and it was causing a lot of discrepancy and differences of opinion.
I'd like to discuss the life of a child with autism and how it affects their families. When did you first sense that your son was developing differently than other children?
Mm-hmm. I noticed his differences when he was little. He was a difficult baby, and he seemed to play on his own a lot, and the children in our neighborhood were born the same day as him. 2 children were born the same day as my son, so there's pretty much a basis of comparison that he was different from them. He started reading spontaneously when he was 3. I noticed all sorts of things about him, but I didn't worry about those things. And I thought, oh, he's just really smart, and that's how smart kids are. And I didn't really worry until he went to preschool and he went to kindergarten, and the teachers would make comments about how different he was and that he wasn't like the other kids. And I would say, well, what does it mean? What do I do with that information? They said, well, we don't know, because they hadn't met many people like Tom before. So when he went into elementary school and he had a difficult time socially, and the other kids sensed his difference and started being cruel to him. And life at home was a little harder because he was anxious about a lot of things or rigid about things. So then I started looking for help.
And how old was he when he was diagnosed, and how did the diagnosis make you feel?
Well, he was 13 when he got his diagnosis, and in one way I was crushed to think that my son had something that was going to possibly affect his future, or maybe he wouldn't have the life that we had dreamed about for him. So I was very afraid. At the same time, I was relieved because we had figured out that he had these social differences and these behavioral differences and communication differences. And the way we look at it is that autism is a pattern of differences. If you have this pattern, then we call it autism. So that was the rational side of our brains thinking that way, and that was actually very good, and we still continue to consider it a pattern of difference and nothing to be ashamed of.
And what is the typical day for a child with autism and for you as a parent of a child with autism?
Are you talking about when they're younger, like school age, for example? Mm-hmm. Well, everything takes longer and is harder than you expect it to be. I would say I find that I have to parent my child with autism much differently than my other kids. And I have to be more organized, more structured, more consistent, because that's what he needs to feel comfortable and be more functional.
And same to you, Mrs. Ramos. When did you first sense that your child was developing maybe differently than other children?
We had a different experience. Iland, well, first of all, girls, it's like 1 in 10 that are females that are diagnosed with autism. And she was a really comfortable baby. She could soothe herself. She played alone. She didn't have tactile defenses. I mean, you could pick her up and hold her. She was just this really, really happy baby. She didn't reach her milestones as soon as our son had, but, I was of the thought that every child develops on their own continuum, so we thought she was just like a late bloomer. She didn't have language right away, but her first language, she made a complete sentence, and she was like, I think she was 3, and she said, "This is ridiculous," and then she didn't say anything else for about maybe 8 or 9 months. She just, it was whenever she chose to. I mean, she would make grunting noises and things, but she had the language. She just didn't choose to use it. I started taking her to different doctors, and we got a firm diagnosis when she was right before her 5th birthday. So she was almost 5. And I had a similar experience. The school didn't know what to do with her, and as a teacher, I had not had any training in autism, and so I didn't know what to do. So the internet wasn't as prolific as it is now, and the books that they had were outdated. And my first readings were about the refrigerator mother, and my husband, freaked out, and we separated for 18 months because he thought that I must have done something during my pregnancy and that I caused it, and luckily we got past all of that, but it was very difficult when she was diagnosed.
And what is a typical day for a life of a child with autism and for you as a parent?
Then or now? Because it's pretty interesting now too. I can tell you about now because she's an adult, and I think most people probably have heard about children and what you do with them, but adults are quite different because she has reasoning abilities, and she can look at you and tell you that she doesn't, like what you're telling her. And but our day starts around. My day starts at 5:30, but her day starts around 7 o'clock with her dad and I tag teaming to get her up and get her to get dressed and put her clothes on and come down and eat something, and that goes on until I leave for work at around 7:30, and then he continues to work with her until her program specialist shows up around 8:45, and then she spends the day in a work-study program with a group here in Los Angeles, and she comes home around 3 o'clock, and then we have a caregiver that takes over then and stays with her until we get home, and she supervises her activities that she does after her program. She has dance class, and she has acting class, and she has other social skills groups that she goes to, but we just keep her busy. But when she was younger, he was tying shoes while I was trying to button the blouse, and I was putting a mouthful of food while he was trying to brush her hair, and that went on right until we got her onto the bus. So when she comes home in the afternoon, it starts all over again. Homework is hands-on. Everything is hands-on. It all takes longer. And it's different and unpredictable.
Miss Iland, is there a difference in the age that a child is typically diagnosed if they're male versus female?
Yes, typically boys are diagnosed around age from 3 to 4, but girls are diagnosed around age 11. And the reason is that, well, there's several reasons, but one is that girls may have a more mild presentation if there's not a language delay. That's kind of obvious, but if they don't have a language delay, they try to compensate for their social difficulties, and they kind of blend in for a while. And around 10, the girls' social life gets so complex that they can't blend in anymore. They may become anxious about it, and a lot of parents realize that they need to go look for help, and when they arrive looking for help, sometimes that's the answer.
And the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders is the standard for a reference for mental disorders. Research, treatment, and insurance decisions are often based off of the DSM. Some experts say that the new definition dramatically reduces the number of people that will be diagnosed with autism, and some think that the previous redefinition from 1994 created an overdiagnosis of people with autism. Ms. Iland, do you agree with this, that it is has been overdiagnosed?
I know it hasn't been overdiagnosed, and you know, people don't know enough about autism and don't have enough training in autism that any doctor you go to would really be aware enough. So you really need to go to a specialist who knows autism. Many people on the spectrum are first diagnosed with ADHD or anxiety disorders or behavior disorders or oppositional defiant disorders. So there are many symptoms in common with different disabilities and different disorders. However, if the person has the pattern, then they should get a diagnosis of autism. We know it's not happening, and there are estimates that as many as 80% of people in our state who have autism are outside the service system. That's an estimate from an informal estimate that we're using at the Autism Society. So that's a big deal, and I don't really think it's overdiagnosis at all, because you either have the features or you don't.
I agree. I know when I first became aware of autism with my daughter, which was 18 years ago, there were doctors in some of the hospitals that people felt, within the community, that they were overdiagnosing it. But I tend to agree with her. You either have it or you don't, and you can tell. I mean, I can see it in my classroom. I see children who cannot get a diagnosis, who definitely are on the spectrum, but because they don't fit exactly into the categories, they cannot get a diagnosis and they don't get services.
And part of that can be parent awareness. Like, if you think that it's imaginative play if your child plays Superman every day, and you tell the doctor, oh sure, he has great imaginative play, when actually that's repetitive play, a feature of autism. Depending on how you understand and report what your children are doing, sometimes it's not clarified to the point of discovery.
Exactly. True. And then some parents are embarrassed too. They don't want their children to be labeled. And I understand that, and I've counseled with those parents before, because it's embarrassing to them. And I'm sure you've run into that as well, and that also impedes a diagnosis.
And speaking about the stigma, that autism is in the Diagnostic and Statistical Manual of Mental Disorders, and it's not a mental disorder. It's a developmental disorder, which is completely different than a mental disorder. So one of our problems is stigma, that we want to, remove the stigma. You should be no more stigmatizing to have autism than it is to have diabetes, because they're both physiological conditions beyond anyone's control that no one has to blame for. And, we like speaking out about autism to remove the stigma and help people understand it in a factual way, because it's nothing to be ashamed of and there's no blame attached.
I try to explain it to my daughter in the same way. I say, if you can't see, you wear glasses. If you don't hear, you need a hearing aid. And with autism, you just need some other supports in place just to help you access life. And so that she doesn't feel that way, but initially she was put in an ED class for emotionally disturbed children. She's not emotionally disturbed, she just learns differently. I mean, her patterns are different.
Mm-hmm. CSUN student Jeffrey Zide can tell us from his own experience what some of the characteristics of Asperger's are, which is currently on the autism spectrum in the current definition. Let's listen.
They literally do not recognize others or like what others are going through. They can't often they can't recognize facial expressions. They can't recognize emotions. They just don't. They lack certain skills. There's a theory called mirror neurons, which are in babies, and it allows basically them to orient themselves and to like mimic behavior. And the theory is that either there aren't enough of them, or that the ones that they have are defective, and to that extent that they can't recognize other people. You really want to communicate, but it's just that you naturally lack certain skills. And that's why it's a disorder, is because there are certain things you have problems with eye contact. It makes people, when you're looking at somebody, you always want to have eye contact, and it's natural for people with autism to want to avoid it because they feel intimidated and it makes them uncomfortable.
Ms. Iland, do you agree with the characteristics that he described, and can you think of other common characteristics that can describe a child with Asperger's or autism?
Sure. Well, he's describing some of what we call social pragmatic features of autism. Social pragmatics is the way we use communication to socialize and form relationships, and that is not innate. The skills are not innate in people with autism. Although the desire may be there, the skills are not spontaneously acquired. So someone with autism may be very interested in communicating or having relationships, but the way their brains are wired, their neurology prevents them. Like he was talking about the mirror neurons, and we're just, there's a lot of research about the effects of having fewer mirror neurons, or the way they're learning a lot by studying the brains of people with autism. And one of the new definitions from Dr. Nancy Minshew, who is a neurologist, is that autism is a disorder of information processing, whether it's social information, processing faces, processing nonverbal cues, processing sensory information in the environment, it's a processing disorder. And then it causes these social symptoms and the behavioral features and the communication difficulties and sensory issues as well.
Is there anything you'd like to add, Mrs. Ramos?
I agree with what he said, and also what she said. We are working with Kaylin as far as the brain. That's where she's seeing a neuro biofeedback doctor at the present time, and she's seen him. I think we've had 15 sessions over the last 2.5 months, and we've seen quite a difference in the way she processes information. And periodically they do, they map her brain to see which areas are working the way they should or better. And we've seen an improvement in her speech. We've seen an improvement in eye contact, initiating conversations. So it definitely, we're a long way off from getting definitive answers, but we do know that that's what's going on. It is in her brain, and it is in her processing. And he's literally reshaping her brain.
The brain is plastic much longer than you would think. But when we talk about problems in the brain, most people with autism do not have mental retardation. That's another one of those false beliefs. And this is not a cognitive problem. It's more information processing than, there can be effects on thinking and reasoning. However, a lot of the basic thinking skills are intact.
What we find with Kaylin is that she processes in beautifully. She understands everything, but she's not always able to process out. So she's not always able to tell us, and it's like we're watching her wake up right now. She's telling us all kinds of things that she's had stored away. Some we're really happy to hear, and some not so much, but we're dealing with that too. But it's all part of the process. But it is nice in the morning to have her actually come down and for the first time in 23 years ask us, how did you sleep, Mom? How was your day today? What did you do? Those are conversations we've never had with her.
Ms. Iland, can you think of characteristics that fit the current definition that would not fit into the new definition?
Well, currently, for example, one of the features of the communication is in people with adequate speech, the inability to maintain and initiate conversations, or initiate and maintain. And that's probably going to go away and be rephrased into something along those lines about the way the person communicates for social purposes. So the communication piece, which has 4 criteria, is going to be reduced but they don't want to neglect the area of communication. They'd like to do a second communication diagnosis. So someone might have autism spectrum disorder and semantic pragmatic disorder, or autism spectrum disorder and receptive expressive language disorder. So they're going to deal with those things separately, and what they'd like to lump together are the social and behavioral and sensory issues that are common to just about everyone on the spectrum.
Is there anything you would like to add, Mrs. Ramos?
No.
CSUN psychology professor Dr. Deborah Barry Malmberg, whose research focuses on designing and evaluating behavioral interventions for children with autism and their families, says that the new definition will leave a significant number of children out. Let's listen.
They're finding that, I think in one study they found that of 26 children who were previously diagnosed with autism, according to the DSM-4 criteria, they found that only 12 of those 26 children would now qualify if the DSM-5 criteria for autism go forward as they're proposed.
Ms. Iland, do you agree with the difference in the number of children being diagnosed that she estimated?
Well, I haven't seen the study, but I believe that there's some controversy around it. If it's the one that everyone's talking about right now, that there's some controversy about it. But my concern is the same as it's always been. If certain people are left out, whether you get the diagnosis or not, based on severity criteria. So right now, we have the spectrum of autism, and we say someone could have PDD, PDD-NOS, Asperger's syndrome, and autism. But certain service systems only accept autism and are already leaving out people with PDD, PDD-NOS, and Asperger's. So I don't know if the same group is going to be left out again, which is a problem, but it's not a new problem. The problem is that some people are left out because their autism is not considered severe enough, severely impacting enough, and I think that is a myth. I think most people are substantially impacted by their autism. Even if they have a higher level of intelligence or great verbal skills, you can still be very impacted by your autism.
Definitely. I remember when Kaylin was diagnosed, there was some question because she was very high functioning and she could do so many things. She was very social and very outgoing, and she, as I said, it was hard to diagnose her. And I was encouraged to make sure she was on her worst behavior that day. And I needed the services, and so I made sure that she was on her worst behavior. She didn't get a nap that day, and let her drink some Kool-Aid on the way over, and she was pretty hyper, and she pretty much discombobulated the entire office. But we got the diagnosis because my fear was at that time is that we wouldn't if she only met 4 of the criteria or 5, because 6 was the magic number, and she had to hit those. So, but I mean, there's no question in your mind when you meet her that she's autistic. There's just no question in your mind, but she is very high functioning. Some people don't notice right away, but if you spend an hour with her or less, you know.
Well, that's the problem when people want their kids to be at their worst, because that's more typical, like say of 60% of your day is when they're not doing as well as they do for a formal meeting in an office where everything's all calm and the adults are managing everything. That's not a realistic way to view a child. So, to skip the nap, that gives a better sense of what the child actually functions like most of the time in the home or school.
I mean, we could not get occupational therapy, but I could get intramuscular manipulation therapy. You had to learn what to call everything. She needed occupational therapy. She still can't write her name. She's 23 years old. She needed it desperately, but in order to get that taken care of, I had to learn the buzzwords. So.
Well, that does bring up one concern, is our laws are written for eligibility, say, for example, for the regional center, which provides lifetime services for people with autism. The criteria is written that they have autism and it severely impacts them. But the law doesn't say they have autism spectrum disorder and it severely impacts them. So we're concerned about the change in terminology in the diagnostic criteria that's out of alignment with the law. The exception being, fortunately for us, that in California education code, you can be autistic-like and receive educational services if your features of your disorder interfere with your education, and that's not just academics, that's social emotional development and other development.
Jeff Struley, Director of J. Nolan Community Services, a nonprofit whose mission is to enable individuals with autism spectrum disorder and other developmental disabilities to live fulfilling lives, says that the new definition will complicate treatments for many families. Let's listen.
It's going to be a fight with different definitions in different environments that you or your family are going to have to be pretty damn sophisticated. Because when you go to the housing authority and say, I need a Section 8 voucher, they're going to say, well, do you have SSI? And when you go to SSI, they will say, here's the definition. You go to the Department of Rehab, they'll have a different definition. I mean, the problem is you're going to have to navigate, 6 or 7 different systems that may give you something, but it may not be coordinated, consistent, reliable. I mean, that's part of the problems.
I would like to hear from each of you, starting with Ms. Iland, as to what steps you would like to see society take to treat children with autism and eventually adults with autism.
I think that I would rather see society respond to someone's needs and not someone's label or diagnosis. If someone needs supports to have an independent life because of a disability, it doesn't matter what the disability is. I think a system based on needs is more fair and would get around some of these problems we're having that's based on language and terminology. So that would be what I would wish for.
And Ms.
I would like to see teachers being trained to teach autistic children. They need to be fully included, but they're including them in a classroom with a teacher who doesn't have a clue what to do. As I said, I've been teaching for years, and the only training that I've had have been at home with my own child and just classes that I've pursued on my own, but they don't really prepare teachers in any way what to do with the children, and everything is all pencil and paper, which is usually the worst learning modality for these children. They need hands-on opportunities, and I also would like them to respond to their needs rather than the label. I know, again, and I can only speak for my own child, but when I would go to her IEP meetings, I would take a picture of her with me so that they could see there was a human being here, because they would just talk about her as in dollars and cents and how much they could afford to do and those kinds of things. And I understand that, but what I always told them is that you can educate her now, or you can pay to have her in a facility for the remainder of her life. Most of these children, if not all of them, that grow up and they become adults are just like all of us. They want to be a part of society. They want to contribute. They want to have a job. They don't want to live on SSI and disability for the rest of their lives. They want a career. But we're not equipping them to do that. We're not setting them up for success. We're setting them up for failure. We're bandaging them as they go along and getting them enough to get them out of high school. And then the minute they get out of school, there's not really a lot of support. It drops to zip.
I'm sorry, but we're out of time. Thank you for joining us, and thank you for watching On Point. I'm Ashley Soley-Cerro.
Slave times when
Confidence of the
American
American people.
The state of
like the
Washington
habit.
district attorney wanted to get rid of it.